You are watching LA Primetime TV.
Hi everyone. I'm sure you've heard of robotic surgery, but are you really clear on what this term means? For many of us, we might think this means a machine is in charge of our operation. Well, don't worry. A well-trained doctor is in complete control of your surgical procedure. Today, we're going to visit Garfield Medical Center, a member of the AHMC family of hospitals. AHMC is a leader in using innovative technology for the treatment of everything from your head to your heart to your whole body. In this exclusive interview, Dr. Andrew Hong, one of the foremost users of the Vinci Xi system, will explain how this new technology can greatly improve the outcome of your surgery. So join us.
Come on in. Towards the head a little bit. More. More. And then come in a little bit more, like 2 inches, and then you're good. Yeah, good. Right there, you're good.
Install the endoscope for targeting.
Pop the drape off and receive that drape up top.
The Da Vinci system has enabled to essentially miniaturize physical hands of a surgeon into a patient in delicate parts of anatomy, often hard to reach places, but instead of the traditional large incision through very tiny incisions. And it is a form of laparoscopic surgery, so folks are generally aware of that minimally invasive surgery, but it's kind of taken it to its latest form, which is doing very complex surgeries, yet through these small, tiny incisions that are literally a few millimeters wide.
And this is not brand new. This has been around now for about 20 years,
That's
right?
correct.
Okay.
That's correct.
So this is the 4th generation that we're talking about?
That's correct. So the Xi system is the newest generation. It builds upon essentially 20 years of technology and learning of what's worked, what's not worked. And the Xi has a few advantages. One, it allows for what we call multi-quadrant surgery, which is moving from, let's say, right upper quadrant to the right lower quadrant in a very, literally in a few minutes time, and not having to move the entire robot or reposition the patient. You really can refocus the system to a very specific part of the body. There's 3 pieces, as you said. The first one is the surgeon console. That's where the surgeon actually physically looks into a very fancy display. It allows for 3D vision. It is absolutely important for us to be able to see everything that's going on, but also focused on very delicate, let's say, nervous tissue that allows us to preserve function after surgery.
Right.
And the actual physical controllers that control the hands of the robot, whatever instrument you have docked to it. There's a middle piece, which is the CPU, or the central processing unit, with a mounted display. All the energy sources are on this tower. And then the third piece is the robot itself, which is, during surgery, docked to the patient. That's what's implementing what the surgeon's actually doing on the console. The robot itself has 4 arms, one for the camera, for the vision, and then the 3 arms allow the surgeon to manipulate tissue inside and do the operation itself. And the nice thing is that each of the arms are interchangeable in terms of what instruments go on them. The Da Vinci system is a fantastic system. It's a very good system, but you do have to train the surgeons to use it.
Absolutely.
And that's very critical. A trained surgeon is utilizing the robot, is controlling the robot. The robot does not have a mind of its own. It doesn't do any of that. It's a great way to think of the robot as a fancy scalpel, a fancy instrument that the surgeon utilizes to perform the surgery. It's a robot-assisted surgery. It's not a robot-driven procedure. For the surgeon, being able to be seated in the most ergonomically comfortable position for 6 to 8 hour procedure obviously makes a difference.
What are the benefits, so that our viewers understand, of using the Da Vinci system?
Yeah. That's a great question. Hospitals such as Garfield investing in this technology, obviously there is a benefit not only to the surgeon, to the patient, and also to the healthcare system. Just having better outcomes, shorter hospital stays, that's good for everybody involved.
Explain more clearly, why do we recover faster after using the Da Vinci system?
In the past, if you're doing a complex operation, for example, taking out a prostate for prostate cancer, it required a very long incision. And that incision allowed for a surgeon to get to the prostate, which is deep in the pelvis. And despite that, there's greater blood loss because surgeons couldn't see as well. With the Da Vinci, with robotic surgery, the incisions are smaller, so healing time is less, pain is less, and also less blood loss. And so because of less blood loss, these patients are able to recover, just from a general health standpoint, much more quickly. And as a result, they get to go home.